The Normatec is a compression device used to decrease a patient's muscle soreness, pain sensitivity, and peripheral fatigue. The dynamic compression of the Normatec cuffs mimics the body's skeletal muscle pump, facilitating a distal to proximal sequence to help aid the cardiovascular system deliver nutrients to fatigued muscles while simultaneously expelling waste products. Red flags and contraindications include patients with current fractures or breaks, acute post-operative patients, open wounds, contusions, or abrasions, deep vein thromboses, severe congestive heart failure, existing pulmonary edema or embolism, the known presence of malignancy in the lower extremities, and the presence of lymphangiosarcoma. Setup includes removing the patient's shoes, ensuring that pockets are empty, and ensuring the patient can comfortably straighten their limbs. Each session is 15 minutes long with 7 levels of pressure. Low is considered 1 through 3, medium is considered levels 4 through 7. So when putting on the cuffs, make sure that the patient's heel is completely within the boot on each side. And the zipper is drawn all the way up. Next, we need to plug in the unit to the hoses of the cuffs. Lastly, turn the unit on, set to the desired time, which is 15 minutes, and the appropriate level from 1 through 7. And press the play button. After starting the session, be sure to inform your patient that the cuffs will start inflating distally first and eventually move proximally section by section. Be sure to make sure that they're at the appropriate level of compression and ask them if they're at a comfortable level as well.
I'm comfortable.
Once the patient's session has elapsed, disconnect the tubes first to deflate the compression cuffs. Next, unzip each cuff. And make sure to use a viral disinfectant to spray after each use. And be sure to reach under the flap and wipe any spots that might be covered up. For storage, be sure to lay flat on the ground. Or it's a fold and hang. So lastly, before you let your patient go, be sure they have filled out the necessary paperwork. That includes the sign-in sheet with the date and time and the treatment log. Treatment log includes filling out the session number that they just did, the body part used, and the level of compression. Otherwise, your patient just disappears.